When Maritza was diagnosed with kidney cancer, the hardest part wasn't just the treatment. It was figuring out what to believe. Between internet rabbit holes and well-meaning advice, she found herself overwhelmed by myths, half-truths, and a lot of uncertainty. Today, Maritza shares what that was like, the confusion, the frustration, and the moments that made her question everything. We're also joined by Dr. Suzanne Merrill, who's helped Maritza and patients like her sort fact from fiction. Together, we'll unpack some of the most common misunderstandings, from sugar myths to fertility fears, and talk about why having the right doctor can make all the difference. This is Kidney Cancer Unfiltered. Welcome to Season 4. Well, thank you so much for joining me on this episode of Kidney Cancer Unfiltered. Before we start, if our listeners aren't familiar with you, I'd love you to both introduce yourselves. Maritza, if you want to go first.
Sure. Well, my name is Maritza. I am a kidney cancer survivor. I guess that's why we're here, right? So I'll start with that. I was diagnosed when I was 36, just 5 months after my daughter was born. And luckily, I just required surgery. So I had that kind of an extended recovery. But separate to that, I'm also a mom, a wife. I work in the financial and airport concessions space. So yeah, that's me.
And Dr. Merrill?
Yeah, I'm Suzanne Merrill. I'm a urologic oncologist currently working with Colorado Urology out here in Denver, Colorado. And I was the surgeon who, again, helped Maritza get through understanding kind of what this was, the gravity of the diagnosis, what treatment was needed, and then helped her with her recovery process and then going forward with her cancer surveillance.
I will say I've spoken to Maritza about our similar journeys, and she speaks absolutely highly of you. Like, she had shared a few different links with me about appearances that you've been on and just like would rave about you. So I'm very excited to get the opportunity to chat with you both together. And one thing that Maritza and I have talked a lot about via, the Instagram and whatnot is medical information. And she's let me know that you've helped her through some of that or some things that she had been confronted with. And so I'd love to start with, and Marissa, I'm going to throw this to you, kind of some of the pieces of medical and misinformation have you received like while you started this journey?
The first big misinformation that I had was just due to miscommunication and me not knowing who to ask questions to. So I remember getting a call from a cancer center and being told I was being scheduled for chemo radiation while I was waiting for scan results to see if my cancer had metastasized. And so that like totally sent me down a rabbit hole of I'm dying, Yeah. And then when I talked to Dr. Merrill, she had told me, well, no, you were just being called for genetic testing. But a lot of times the people that are making calls or answering the phone aren't experts in that field. And so I think that was something early on I learned how to navigate, is just knowing who to ask questions to, and don't ask questions to anybody other than your doctor or maybe somebody who's been, in a similar situation. But specific to my case, I think that was the first thing that I realized was, oh, you can get told the wrong thing and that can send you down a rabbit hole very quickly.
I think that as survivors, when we think about medical information, we automatically go to the sugar causes cancer. No, it doesn't kind of do. But that it can even be in just miscommunication. And there's so many levels to it. So I'd love to talk, and Dr. Mel, I'm going to throw this one to you. I'd love to talk about how something like that, right? Like where it's just a simple piece of miscommunication that can be based maybe on medical information of like what type of treatments are available, whatnot, can really actually maybe harm a person's journey through cancer.
Yeah, and I think this is confounded by a couple of levels these days, right? Our kind of delivery of healthcare now requires there's so many people, a lot more people getting sick, right? Our treatments are prolonging life, which is a good thing. But this is really requiring a lot more people to be involved in kind of the healthcare delivery in some form or fashion. And not all of us are and can't really be up to snuff on kind of what's going on with that individual patient, right? Some of our, providers, if you will, or staff in the healthcare delivery are merely schedulers, and so their level of medical education is not required to be that high to help us out with their required kind of duty or job description, which can be just seeing where a patient needs to go, understanding what that provider needs, etc. But they don't have the background on what is going on with that patient. And I think this is what Maritza is describing is, we wanted a multidisciplinary team approach for her cancer. It was a bit more complex. She had a very challenging size of tumor, location of tumor. And then Maritza, I don't know if you remember on her, another part of the miscommunication, part of this was she had access to her scan reports. And this is part of trying to get the information to the patient in a timely manner, not have to be relied on the provider to give her that information. But it does cause some questions when these scan results come out as to what does this mean? What are the implications? And she had a couple lesions on her liver, which thankfully ended up being just hemangiomas. So nothing cancerous, nothing to do with her kidney cancer, but certainly, at first pass, really through even us providers, we need to look further into this. But from a patient standpoint, look very much scary, uncertain as to what this future held. And so again, it's a challenge with how much information is being thrown at the patient and the correct information being given to them, especially when we have, again, technology, these MRI scans being available to our patients. And then we need these extra, staff to help us with carrying out the delivery, but don't have that, education to provide to them. I think a long-winded answer, certainly what we probably need to do to improve upon this miscommunication from that healthcare delivery scheduling standpoint is to provide those staff members with a little bit more context. And I will say that is reliant on the providers to make sure that when they deliver that information, even though they don't have that education, that they know the context. So probably what happened is she just needs an appointment at our, Rocky Mountain Medical Cancer Center, which has a lot of different avenues on how they deliver care. And there wasn't probably context on why this appointment is being scheduled, and then that threw her for a loop and that poor staff member as to why this appointment was being scheduled.
I will say I love long-winded answers. I am the type of person who writes a novel in a text. So long-winded, perfect, because you actually brought up something that I wanted to discuss too in that answer. And it's about the scans and getting the scans early. I think that ties back to medical misinformation outside of this. So I don't get my scans early. I know a lot of people who do, and they get them way before they actually talk to their doctor. I don't. And I will talk to my survivor friends. I'm like, I'm actually grateful for that. Because if I were to look at my scans and see something, I know I'm going to go to Dr. Google and look at all the reasons why this might be this, even though it's nothing to do with that. And I mean, Maritza, you might have seen that with like maybe survivors that too, but we all tend to have a tendency to go down a rabbit hole when we're worried about our own health. And so I'd love to just kind of pull on that thread a little bit more about, the delivery of the scans and patients reading them, and then like tying that kind of back to what Dr. Google says, when all you have is maybe this like little line in a scan that makes no sense to you, but maybe there's like 20 surveys with that keyword or studies with that keyword that pop up. And I think, Dr. Merrill, I'd love to start with you on this and kind of how can we, I don't know, control for that a bit more. Control may not be the best word, but that's the one that kind of pops in my head right now.
Yeah, I think so. We all realize it's important to get the information as soon as possible to the patient. It is their information. It's their bodies, right? It's nothing that we should be withholding, right, from the patient. And as we get into this very convoluted, healthcare delivery system, we're finding that, it's hard to be timely all the times. And so sometimes, right, as you mentioned, scans are being done, but the appointment is not for maybe 1 or 2 weeks later. And so it's not very fair to hold that information from the patient. But at the same token, right, just like you said, how can we, in quotes, control or protect the patient from going down the rabbit hole of, again, the anxiety provoking of what is this, what we call we call it incidentalomas, these haphazard findings on the scan might not be anything, but to the patient, very uncertain, very anxiety provoking when they already have a cancer diagnosis or they're working up a mass. And so what I would recommend is now that we're in this situation, the patient gets the information sometimes directly from the imaging center, not only from just accessing their medical record anymore through the provider's facility, is that, that the patient needs to know this is happening. You will get the context appropriately when you see the provider. But up until then, yes, if you are driven to the internets to look at what this means, then you need to take it with a grain of salt. And that, yes, if you are very much, this is anxiety provoking, feeling anxious, we now all have these web messaging, portal messaging with your provider. So certainly before anything rash is being done with finding out some information and trying to Google it, search what it means, message your provider. Express your anxiety of what you have just found out and that you are trying to seek some reassurance before that meeting that you have with your provider. Or maybe could you schedule an earlier meeting, a virtual meeting? We try to do all these sort of connections and touch points with our patients outside of the typical in-person visits to try to help this out and try to make ourselves more available. And so that's what I would kind of relay to, our members that are listening to this, watching this, is that reach out to your provider if you found something very anxiety provoking on your scan before you make any rash kind of movements, and try to find an earlier time to get that accurate information by your provider.
So I think that's a really great point, Dr. Merrill, and great advice to reach out to your provider. I know for myself as a survivor and other survivors I've spoken to that there's somewhat of a fear of reaching out to their provider because they don't want to seem like they're too anxious or going down too much of a rabbit hole, and they don't want to be annoying to their provider to kind of address this misinformation that they may be faced with because they're going on this Dr. Google search. So Maritza, for you, I would love to get your opinion and maybe your advice for other survivors of how do you make yourself feel comfortable to reach out to your provider when you're kind of faced with medical misinformation?
I don't know that I would have ever known I needed a comfort level. I think that speaks to the empathy that Dr. Merrill showed me and the compassion she showed me and my whole family that came along to all my appointments. I think I took like the crazy ex-girlfriend approach where I would just call the office and then I would usually get a call back from Dr. Merrill. I don't think that most doctors, I don't know, from other experience that I've heard, specifically in this kidney cancer space and specifically people in our age group, I've heard a lot of patients feeling dismissed by their doctors and kind of like you go through this really traumatic thing, you have this surgery, you're lucky you don't need further treatment, and then see you in a year. Like I feel like that's a lot of the experiences that I've heard shared with me. And so I never felt that way. I never hesitated to contact Dr. Merrill or email her assistants or call. And so I think like I said, I just think that speaks volume to her approach as a doctor. And maybe that's where other doctors can take, note on how to better their approach. But I never felt a hesitation. And I think, especially when you're in that newly diagnosed space of you don't know what's normal. You don't know what to expect. You're awaiting results. And so I think that was just like my first gut is ask her. And I would usually come bring her, I would usually walk in the office with some type of whatever I was freaking out about at the moment, or whatever I misread or misunderstood from my scan. But I think that I learned very quickly, go straight to your doctor, go straight to the expert, because the whole Googling it didn't ever go well for me.
Yeah, and I think just for anyone, there's just so much on there that
Mhm.
just, especially when you have studies that may be debunked, or like there's another study that, debunks another study or debunks this myth. There's just so much, and you just don't know what to believe. So it's great that you have such a relationship with your provider, with Dr. Merrill, to be able to go to her with questions. I would love to dig into some other pieces of maybe misinformation that you've either were confronted with or you had to talk together to talk through. What are some other doozies you've heard throughout your diagnosis and treatment?
Um, I remember the diet being really confusing. I left the hospital with a renal diet handbook and I followed it so strictly. And I had a complicated recovery. And so my kidney wasn't healing or sealing, or Dr. Merrill, you can tell me what the proper terminology is. But I ended up having a urine leak. And so I had a very extended recovery. And so meanwhile, I'm depriving myself of things like protein and things that a renal diet is very strict about. And this was another thing that I remember asking Dr. Merrill, like, I was told to hydrate, 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 but then it was discovered I had a urine leak, right? And so she was very practical in her approach, I thought, to say, okay, let's get rid of that. That's a very generalized diet that anybody with any kidney type issue gets at the hospital. And it might not have been looked at very thoroughly or specific to my situation and the recovery that my body was going through. But I do remember the diet being very confusing. And even when I tried to do my own research, it's like there's kidney disease, which, kidney failure and transplant and dialysis. And then there's kidney cancer. And I remember thinking, well, isn't kidney cancer a kidney disease? But there was so much more dietary guidelines for kidney failure.
So, Dr. Merrill, how did you talk to Maritza about the diet? I know she just gave the example where you took a very practical approach and kind of said, nope, let's put that aside and really kind of focus on your case. But how did you approach that and kind of help Maritza walk through what essentially is nutritional misinformation for her case?
Yeah, for Maritza's case, her kidney function, because we did a partial nephrectomy on her, and it was a complicated, kind of technically challenging partial nephrectomy because her kind of almost 7 centimeter mass was in the center part of the kidney. And so it required a very challenging reconstruction. And even though in the hospital it looks like she was, getting through with flying colors and being able to be discharged in a relatively timely fashion, it wasn't until her post-op kind of follow-up as an outpatient that we discovered she developed a urine leak, because it did come close and the collecting system needed to be reconstructed. So interestingly, because she had actually, we were able to save the majority of her kidney function really did not kind of at all decrease at all. It was pretty much stable. After surgery, she did not require any alteration of her kind of nutrition. But interestingly, from again, it's the multiplicity of now healthcare providers, involved in this one patient's care is where it gets tricky. So you have a hospital system seeing and nurses, again, well-trained nurses caring for, again, surgical kidney patients all the time. But what they kind of see is that this is a kidney surgery. And so it's kind of very much in like a silo. The again, better education could be delivered. And this is where we'll get to this, is that they say, okay, kidney surgery. Yes, they're fitting into what Maritza Maritza just said, they probably kidney disease. They should have, therefore, a kidney specific diet. And they know too that patients are looking for nutrition guidance, right? This is something that I think they feel that, our nursing team can deliver pretty accurately what an appropriate diet should be after surgery, et cetera. And I think they take it upon themselves, to deliver that educational piece. But probably as providers, we're not doing a good job, again, educating them as to all the differences in kidney surgeries we do, to really look at that creatinine level afterwards, which should really dictate, should we have an alteration of diet? And so, unfortunately, poor Maritza, and to tell you the truth, this was unbeknownst to me that she was placed or recommended to be on this renal diet, which in, an after surgical situation where you need good caloric intake, to provide your body the resources to heal, she wasn't actually getting initially until we had this discussion. And then with, again, having this urine leak, she definitely needed to ramp up her caloric intake, which also includes, good protein intake to heal, at which point we, got her back on the right track so we could get this kidney to heal, which thankfully it ultimately did with, minimal, intervention. So I think bottom line, it probably, again, is on our, the provider to provide better context to all our deliverers of healthcare. And I think that's where the challenge comes, and where baseline this misinformation can come, is that there's so many providers or deliverers of healthcare, and healthcare is just becoming so complex to deliver, where, again, these balls get dropped, unfortunately.
Yeah, and with nutrition, that is absolutely one that we often hear about. Maritza and I were on a virtual retreat that the KCA put on, and that's a topic that came up. And one thing that we hear often, I'd say, is the differences in the recommendations that survivors receive. So some, like Maritza, may get a renal diet. I myself were just told to watch certain things and then I'll be fine. Others are like, I didn't have to change anything about my diet. Then there are others who get something in between, and it gets so frustrating when you talk survivor to survivor, because you might have someone who's like, I really don't know what to do. And it's like, you don't know where to go between those. And I would love to kind of just pull on that thread a little bit more about what providers can do to help with that education, to better educate. Is there a standard of care that needs to be established, countrywide, maybe even worldwide, where here are the kind of steps that you have to take and this is what applies? How do we kind of maybe not prevent, but minimize that, like those conflicting pieces of information that end up happening?
Yeah, and it might be through something like, again, KCA, in that, information provided from a organization that's supported by, providers and survivors, et cetera, to kind of put it out there as to kind of what, a diet should look like after you've had kidney surgery for cancer, etc. And to tell you the truth, it's really reliant on what ends up being the creatinine at the end of the day. And that really kind of divides the patients into needing, if we have bad kidney function, whether we started out not so good, then we did surgery and now it's worse sort of situation, do we need to take more of an approach of a renal diet, which, is heavily advocated in a, again, more kind of chronic kidney disease patient, can be very helpful to have a low sodium diet, low protein diet, etc. Or is it a patient that really, no harm, no foul, good kidney function, yes, kidney cancer survivor, ultimately there should be no really true modification other than ensuring kind of good hydration for the kidneys. Unfortunately, with a lot of cancers out there, kidney cancer, any other urinary tract cancer, there is no good cancer specific diet to either, help prevent that cancer, or again, improve, again, the health of that organ necessarily, there's no great evidence. So I think there is a lack of, unfortunately, research and probably interest and money in research to look at these things of what may be a very good specific diet for these again, cancers, for these organs, etc. And ultimately we just have to kind of, what we recommend is kind of the heart healthy diet, after these big surgeries and for these cancers. If the kidney function, for kidney cancer at least, kidney function looks good.
Well, I actually do, since you brought up creatinine, I do know, and this is something that I have covered myself just because I'm a bodybuilder. I do know that muscle growth can actually impact the creatinine level. So it may not necessarily always be accurate of their function. Are there other markers that survivors also need to kind of pay attention to when it comes to their diet? So they know, like in their labs, so they know more about what they should be eating or can guide themselves more about what they should be eating?
Yeah, it's definitely a good question. There's a lot of different ways to calculate kidney function in the body that certainly are more accurate than just that serum blood value called creatinine. One very basic one is a calculation that comes through, the blood test, the basic metabolic panel, or the comprehensive metabolic panel called GFR, glomerular filtration rate, right? Which is probably the next easiest kind of, again, value to look at for, from a patient perspective, from a provider perspective, to look at more how, again, the individual, okay, kidneys are functioning. But even further down that line, or even calculated values, we can do even values in the urine, etc. They get more complex and not as readily available, but probably the GFR is the next easiest, to tell you the truth, marker for, again, all comers to look at, that makes it more individualized as how those kidneys are functioning for the individual.
Okay. Well, we can step away from that. I was just, it's just something I know I could launch into very, very
Mm-hmm.
quickly, because there's just so many different things that kind of impact the labs and everything. And I think we've covered it a lot in the podcast in different ways about how there's so many different ways that things can impact your function or what comes through on your blood. And you don't necessarily have a doctor who's maybe keeping up with, renal guidelines for nutrition or with their research. It can create, again, that misinformation where you're
Yeah.
getting things like, hey, stay away from sugar, or don't eat this, or eat this amount of protein, even though like you're a highly active person, or like you can never lift again, which is something a lot of survivors I know have heard, because it might hurt your kidney and all of this stuff. And I kind of wanted to get into those things that maybe necessarily aren't particular to one specific case, but more of just stuff that you've heard just existing. Like, what are some pervasive myths or misinformation that you hear that are related to the kidneys? And what is the truth, if you will? And I'll leave this up to you. Do you decide if you want to just jump on one already? I know I've mentioned a couple.
Maritza, do you want to go with any more that kind of, with your particular journey that you've experienced?
Yeah, I don't even know if it was anything like specific to my case or my recovery or anything, but I do remember, trying to dive into, how do you minimize the chance of recurrence, and changing cleaning products, laundry detergents, shampoo, like that whole route of, trying to be chemical free and eat all organic foods. And I think the most confusing thing for me was always, there's not a lot of guidelines, right? And then there is the whole misinformation. There's a lot of gray area, a lot of opinions out there now that aren't really backed by research, but there's nothing specific to like the age group that I'm in. Anna Maria is a survivor as well, like the age group that you're in, because I feel like, if I was a 70-year-old man, like probably most of your patients, Dr. Merrill, it might matter less, right? Like my diet matters, but in the long term, my remaining life is longer. And so I don't even know if that makes sense, but I feel like there's just so much gray area, and it's confusing when you're trying to decide, how much to change your life, how much to change your diet, how much to change your products, and all the questionable environmental effects that could cause any cancer or increase the chance of recurrence or even another primary cancer. So I feel like that's where I've had the most confusion, and I think there's just a lot of misinformation out there in general.
Yeah, and I think again it goes into that there's only a couple of environmental exposure risks that we can really hang our hats on, and others maybe there's some links, but they're weaker. And yeah, this is a common thing that a lot of us providers hear from our patients that after, thankfully, the patient, and this happens a lot with kidney cancer, that the patient again gets diagnosed, gets treated, we're in a good space, we're following, and now they want to know what else they can do for themselves to just prevent a cancer recurrence and kind of having a straightforward journey going forward. And really, the biggest, exposure risks that we know of are first and foremost tobacco use. And obviously for Maritza, that was not a factor. And these, I feel like, again, kind of, eagerness to know what they can do really are more in our younger patients, because it is actually more unclear when we have a patient who is young who is diagnosed with kidney cancer. I think the biggest thing that I can tell for our listeners today is that certainly anybody diagnosed kind of 46 and younger needs to undergo genetic testing. And Maritza brought this up at the forefront because, again, this was very much a part of our discussion, trying to understand why this has happened to her. It was certainly a question at the forefront of her mind, not only trying to sort out kind of next steps in treatment, but the big why, as she didn't fit the typical profile for for kidney cancer. And so that's very much important to make sure we're not missing, again, a mutation that could be a part of a bigger cancer syndrome, for example, and she needs screening for other cancers, or again, could put into context about how to better treat this particular cancer, for example, or presumed cancer when we had initially, the scan showing us that likely this was going to be a kidney cancer. When with certain mutations, we actually approach them differently, maybe more aggressively. Wouldn't have tried a partial nephrectomy, for example, and would have just taken the whole kidney if there some mutations would have popped up. Thankfully for Maritza, there were no genetic alterations present, but that still leaves the big why then. And so I think this is a challenging misinformation piece, and it's just because we do not have, again, enough research to back up as to why we're seeing this. And we call this, in Maritza's case, a sporadic kidney cancer case. Again, we don't have a cause and effect, a genetic mutation. We don't have tobacco use. We don't have, obesity as a call. We don't have, at least what we know, any of these chemical exposures, which there's some link. And so, right, and how to guide Maritza going forward, it's very challenging. And so, the approach that she took, which is to try to, engage in more natural products. We had this conversation of getting rid of the Teflon and, from the pans. And hey, if you can afford to do that, my approach is, why not? We're not sure if that is, a cause and effect, but certainly we do know Teflon. We all seen it. It kind of scratches off, it's into the food. Of course, probably not the healthiest, but is there a true cause and effect? Not sure. But if you could afford that change in a lifestyle approach to things, why not? It is kind of how we kind of went forth with her, and trying to, again, eat more organic. Certainly, that I'm sure that it can have a positive effect, but can it have a effect from a kidney cancer? Not sure.
Mm-hmm. And I do remember like getting pretty clear advice about that from you and saying, well, these are all good environmental changes, right? So if you can do them, and even if it brings you more peace or you feel like
Mhm.
more, you know, sanity in making those, then yeah, why not? Which I feel like has helped me a lot to just say, okay, at least I'm not paranoid every time I use the dish soap or run the dishwasher. It has given me a lot of peace to say, okay, well, if those are factors, if they could have affected, they probably didn't, but at least I've eliminated them.
Yeah, and I think that's a, kind of logical approach, the approach of like just kind of caution, not
Mhm.
necessarily with that all or nothing attitude of like, I
Right.
must do this because this says this, and therefore, it's, again, I know I've mentioned it a couple of times, and I would love for you, Dr. Merrill, to talk about this, but it's like the sugar causes cancer,
Oh yeah.
myth, which has
Mhm.
been debunked, and it's not true, but you still hear it, and there's this
Oh
idea
sure.
of like, I've heard it from survivors and doctors that like you must eliminate it completely because of X, Y, and Z. And then you get into the debate of like, well, cancer doesn't work that way because if you eliminate sugar, it's going to feed off of something else. So, Dr. Mero, I would love, because I'm sure listeners are probably going to listen to this and go, well, what about that? I'd love for you to talk about that particular one, and maybe others where, seed oil, I think, is one I hear a lot about, seed oil causing cancer and other things, and
Mm.
how damaging this pieces of misinformation can actually be to a patient.
Yeah, and to tell you the truth, it's very challenging to control that dialogue that's out there as it's propagated from, advertisements on the internet, etc., and then again other patients, etc. So ultimately, we all get this question a lot of how to approach kind of sugar in the diet, and because there's really not a lot of evidence backing it up that yes, this is definitely something we need our cancer patients to avoid. I don't ascribe to recommending patients to eliminate it from their diet. Ultimately, yes, having a you know, uh, again, I'll just say again, a more pure diet, and where you don't have a lot of these processed kind of elements in the food that you're intaking certainly can be healthy. But all of our cells need energy, and energy broken down into the very simplest form is a sugar molecule. Okay. So we really cannot carry out our lives without the incorporation of some degree of sugar in it, because all of our even healthy cells need that to run. And so, what I tell patients is, if this makes sense to you, that you want to try to reduce down kind of your processed sugar, sure, it is going to make a healthier diet for yourself. But, if it brings you happiness to have, for example, some processed sugar, whether it's, a cupcake at a birthday, or, an Oreo after, accomplishing something great, go for it. I mean, I feel like, a lot of us, myself included, get enjoyment out of having some sort of sugar at some point in time. And, it's okay. I don't think it's going to really rock the boat. There's not enough evidence there to substantiate elimination of sugar in the diet.
Now, Maritza, what are some other pieces of misinformation you may have heard, whether or not you've talked to Dr. Mero about them or not? But like, what are some other ones that you've heard that you would love for us to address today?
I mean, I've definitely brought up the like, fertility, should I be done having babies question, because I know there's a lot of cancers that are, like hormonal based, I guess. I don't know how to medically say that, but I think that's one thing where it's like, okay, well, no, it's not over your inner breast, but is there, knowledge out there, any research out there that says, if I get pregnant, it's not going to increase my chances or make it come back or anything like that. And I feel like that's one of those I've heard a lot of, oh, you shouldn't have more kids because
Yeah.
your cancer will come back. Although I had it the whole time I carried both of my
Yeah.
kids. And so that's one thing that's always been confusing to me too, is like, well, I never felt any different. Like nothing, I had no symptoms or indication, I certainly don't attribute my pregnancies to it. It didn't get worse. It didn't spread. It didn't, do any of that. So I think that's one area there's just a lot of opinions out there. It's
Yeah.
not very clear.
I actually got the opposite when I asked my gynecologist after a couple of months after I had my surgery if I should have a child again. I was told, or if I can't have a child, I was told that my age plus having one kidney would make me too high risk and I shouldn't have a child or I wouldn't
Okay.
be able to carry one. And then I went to a conference like late last year or like at some point last year and I asked the same question to a onco fertility doctor there and she was just like, no, that's not true at all. And I'm like, okay, so now at this point, I'm not going to have a kid because I'm 42, but it's like, I spent like the last 5 years thinking my body couldn't carry a child, and that's not actually true. So yeah, Dr. Merrill, if you can, I don't know, address this fertility issue because that has that conversation rather is something that's come up a lot recently. I just heard about fertility and kidney cancer.
Yeah. So again, as far as we know, there does not appear to be a connection. I think we're kind of maybe these hormonal aspects have come into play is that obesity seems to be kind of related. There might be a cause and effect. But I will tell you, this research that tries to look back at kind of the exposure environmental factors is very challenging research, right? There's a lot of things at play when we look back at time to figure out what was the cause. It is, and we know it's kind of muddled, and we try to do the best with controlling for things, etc. But it is, none of this or most of the research and looking for exposure is not a forward in time or perspective or randomized research. So in that regard, it's mostly a retrospective analysis, and those analyses are again kind of at high frequency of having again kind of errors, or just there's a lot of more than a straightforward cause and effect. All right. So again, as far as we know, there does not seem to be any, again, fertility, again, connection or the hormones rising during, again, when we've conceived and all the hormones that happen at that sort of time. And then when carrying a pregnancy, we don't see that. I will tell you with some benign tumors, okay, of the kidney called angiomyolipomas, we do see a kind of surge, okay, of possibly their again incidence in women during kind of these hormonal fluctuation periods. So again, is this how some of this kind of misinformation has traveled? Is we do have some kidney tumors that are more hormonally connected than others. But as far as, again, the renal cell carcinoma, the typical type of kidney cancer, there doesn't appear to be a straightforward connection.
Yeah.
Mhm.
Yeah, and it is really hard with a lot of topics to see kind of where the misinformation started and to even think about how you can start unraveling it because it just ends up becoming so widespread that no matter how many times you might vent on blue sky saying, hey, this is not how it works, people just there's a passion in misinformation, if you will.
In general, there's not a lot of research, like we talked about, differentiating like kidney cancer patients in the age group.
Yeah.
And so naturally, if most patients that have kidney cancer are men, 60 plus or 70 plus, there's not going to be fertility studies around that.
Mm-hmm.
So I think that one of the reasons there's misinformation around that is because there's just not a lot of research. And so, there might be, like Dr. Merrill said, one instance where something happened and it was, that person's an outlier, like I'm an outlier, like you're an outlier, Anna Maria. And then people start to believe, oh, well, that happened because, right? Or, oh, she was pregnant and then she got cancer, or she was pregnant and then her cancer came back. And so I think a lot of times people just speak on experience that maybe they don't have, like almost hearsay, they don't have enough information around it. And so anyways, I just wanted to mention that because I think like specifically women in this kidney cancer space, there's no research specific to us and our bodies, or, if we're in, childbearing years, I feel like there's even less, honestly.
No, I think that's a really good point because there are a lot of studies out there that are based on a certain sample in a certain group, but they're applied, they're like blanket applied, kind of like again, let's say for example, like protein and kidney health. A lot of those studies have been done on like sedentary, like on non-active people,
Mhm.
maybe have two kidneys, and so you get that kind of blanket application across all different types of people who may be dealing like with kidney issues, just to go back to that one. But I think that's a really good point of how we have a lot of these studies that may have a lot of limitations and they just end up getting applied. And I think that goes to the last question is how do we address that? Like, what are some ways that we can address that? So we just allow people to make more practical decisions or to kind of just calm whatever anxieties they're feeling um, about whatever they're hearing.
Yeah. No, that makes sense. So as far as like what advice I would share, I think, I hear a lot of people say, get second opinions. I really liked Dr. Merrill. I really like the doctor that she works with, other oncologists that I see. So I was really lucky to not have to do that. And I had a really smooth, as far as my relationship with my providers, I've had a really smooth relationship with them. But I've heard a lot of people say, I've just heard so many people say that in this space, they don't like their doctors, or not that they don't like their doctors, but maybe that they just didn't get a lot of care or empathy because, again, this is one of those good cancers, right? And so I would say, one, seek out other providers, because I do think that, and this is why I think it's so cool to have Dr. Merrill and I on together, is because you don't see this doctor-patient dynamic a lot. You go to your appointments and, there's usually just you in the room or maybe a family member. For me, it was my husband. My dad would come every once in a while. I think my mom was in a few, but this is a part that's kind of more intimate. I guess people don't see this part of the cancer journey. And I would encourage people to find a doctor that mesh with and that you feel comfortable asking questions. Like I said, I took the crazy girlfriend approach where I would just like, I'm the I will find you patient, where I would email Dr. Merrill and she was always I always got a response. I would leave messages and, she would call me. And so I do think that relationship is possible. And I think that sometimes we're just so lost and confused and we have this, whiplash of what's going on. And it's a lot of times an unexpected diagnosis. And so you just don't know where to start. I think the KCA has the excellent resource for finding providers in your area. Because like I said, I was in the emergency room. I got referred to a doctor that ended up being Dr. Merrill. I didn't have to seek out, I wasn't trying to find answers to symptoms. I didn't have to seek out a provider. I kind of just landed in her office and it worked out. But again, sorry, I feel like I just keep saying the same thing, but I would just really encourage people to find a provider that they like. And then also to seek out some type of mental health support, because there is so much emotional whiplash that comes with this, especially when you got a diagnosis you don't expect. And then, from what I've heard, it's usually like 3, 4, 5, 6 weeks to surgery, which during that time feels like an eternity. But then all of a sudden you have surgery and you're supposed to feel better. And then you don't, because you're then processing, waiting for pathology. And so I feel like that was really helpful for me. And I know that in all of my appointments, whether it was Dr. Merrill or Dr. Bupathy, the other oncologist that I see, they were always really good about saying, okay, like here's the medical situation, but how are you? And I don't think it was until they asked me that I even had time to assess how I was doing, because it was just, happening really fast. And, I have husband and kids and a job and all these things that you're trying to juggle and balance. But I think that mental health component gets dismissed a lot, especially when you're a cancer patient that doesn't require chemo, that doesn't require radiation, that doesn't have this long-term, you don't look sick. And so I think even like for ourselves, it's easy to dismiss our own feelings as patients and survivors. And so I feel like that was really helpful for me.
I think that doctor patient relationship is really honestly a key to combating misinformation, because if you don't have someone to talk to, or like you see who you're comfortable talking to about these things, you're going to go, when you're in a state of anxiety, you tend to want to find things that are confirmation bias, right? Like you're going to look things up that kind of confirm your worst fears because you're just in that state of like anxiety. And or you're going to you're going to turn to people who seem like they know what they're talking about when they really don't. I think one myth, and I know we have like a couple of minutes left, but this just made me think another myth I wanted to, or piece of misinformation I wanted to talk about is biopsies being, problematic or unsafe. That's something that you see a lot in support groups. And again, if you don't have a doctor to turn to and you're going to support groups, they end up just devolving into like these back and forth debates no matter what is out there. So one, Dr. Merrill, I would love for you to just quickly answer that biopsies equal bad kind of misinformation, but also just responding to Maritza's, piece of advice of having that good doctor patient relationship, how important that is to help combat misinformation.
Yeah, of course. The biopsy question we get a lot. Is it safe? Is it going to spread my cancer, et cetera, and make it just now go all over the place? And ultimately, biopsies have been safe for quite some time based on kind of the tools we use. Ultimately, there's a sheath, so an outer cannula that surrounds the needle that goes to the organ of interest or the mass, and then the needle is deployed from the organ to inside the mass and then back into the sheath. And so the sheath is what is going into the body and removing that needle with that, tissue core inside of it safely. So that tissue core that supposedly holds the cancer is really not exposed to anything but going through the mass and then back into the sheath, and it stays protected. So we really have no evidence that, that these things seed the cancer, spread the cancer, et cetera, at all. I will tell you in the majority of our, kidney mass workups, it's not always that we're recommending biopsy. I actually lead my discussion, or it's part of my discussion with my patients, that imaging is actually the biopsy in many cases. Is imaging, when done correctly, the right scan, etc. It has to have contrast, unfortunately, in it. That this can lead to a very good assessment and concern. Is this cancer? And it can allow us to move to that next step of treatment without needing that intervention of biopsy, which can delay, again, getting to treatment, and also can afford us a slight, risk, but usually biopsy is pretty safe. So on the, other topic of how to, try to avoid, misinformation, as I think, Anne Maria, you really kind of brought up that there is misinformation on all levels at any pass. I mean, it's hard to account for all the possibilities out there. And I would encourage kind of the listeners and patients really to, yes, reach out to your provider. And as Maritza said, if your provider isn't being responsive and taking you seriously, then I think that should be a opportunity to consider that second opinion that Maritza brought out, as an opportunity to see if, right, maybe you can establish a better provider patient relationship, to one that will be more responsive, whether by portals or seeing you or taking that time in the visit to discuss all these other aspects of, again, dealing with the cancer with you, outside of just that technical part of how we diagnose, how we treat, and how we recover. As there's a lot more to, again, handling a diagnosis, treatment, and recovery outside that just kind of technical issue with it. And I think, unfortunately, it is, up to us providers, and to encourage our providers that there's, and we all know this, I think it's just, there's a lot of us just get, again, just buggered down with the time, only having 15 minutes with our patients, and, so many patients on our schedule. Those are not excuses, but it is reality. And, we many times are so focused on, again, the technical details, that again, the disease aspects, that we don't treat the whole patient holistically. And many times don't do a good job, and it's very unfortunate and leaves the patient hanging with a lot of anxieties, and again, just openness to the misinformation that's out there. And so we should definitely do a better job, and hopefully, again, with things like this, the podcast, that KCA puts out, and that just KCA and its resources can be even another opportunity for patients, again, to get, again, reliable information, or to get reliable resources by which to seek out correct information as well.
Well, thank you so much, both of you, for joining me. Is there anything that maybe I didn't touch on that you would like to say before we close out?
I would just say, we talked a lot about right now, just, making sure that you and your provider are a good fit. And I think that it's important to note that regardless of how good your provider is, you're going to face misinformation. I have walked into Dr. Merrill's office with all the topics that we've talked about. Do I have to stop drinking, flavored creamer in my coffee, and like Teflon, and all the cleaning products, and the diet, and all those things? I love my doctor, but I still, I'm not with her 24/7, right? So all these external factors are with you regardless. And I think it's just a lot of how you navigate it. And I think the further, at least for me, the further you get away from the diagnosis, the easier it is to kind of dive into those things. I think I had that phase in that space of I was just in it, and I just wanted to get out of it, and I didn't want to read articles or research or know too much, and I would ask questions kind of naively without doing proper research or just relying on Google. But I think the further away I get, the more I'm able to take in information and kind of decide, okay, what is worth my anxiety, what is worth my stress, what is worth asking my doctor. Because again, it doesn't matter how good it matters how good your provider is, but we're separate to that. There's misinformation everywhere. And it's kind of just where you're lending your ear and what you're willing to listen to.
Because again, when you get into that moment of anxiety, when you get into that moment of fear, you're going to find something that's going to confirm your fears, right? Like you're going to look at things that are like, oh, this says this is my fault because I did that. This must be my fault, right? And it's not necessarily coming from a rational place, which is understandable because cancer is traumatic. And you get all these messages. You can be like, oh my God, I did this, this, and that. You're just there's that shame and guilt, not to keep us longer, but I think it's just a great point that you brought up about, the first days in your diagnosis, you're in this different space where you become more susceptible to misinformation because you're not coming at your cancer rationally, right? How can you really? It's a traumatic thing. So, but thank you both so much for joining me on this episode. It's been quite educational, so I really appreciate the time.
Of course, happy to be here.
Thank you.
Thanks for listening to Kidney Cancer Unfiltered. If you found this episode helpful, be sure to like, share, and subscribe wherever you listen to your favorite podcast. For more resources and episodes, visit kidneycancer.org or follow Kidney Cancer Association on social media. Until next time, take care, and remember, you're not alone.